Some of them think they give you hope about salon. We see some of them investment there and things that we go help, for save lives and things that we go make the salon man no emergency and need for travel, for go out, for get medical support or health care. They give you hope. They make you believe, say, we can do things as a people, we can do things as a country. And there are things we definitely can achieve, whether we political will they, and we serve as people and ready for give the support and do it in right. Sometimes, then here, we then are so now we the people and get for take care of our nation. Leoneans and get for work day, na salon people and get for the good day. So we get a responsibility for also handle it. I don't see videos them and photos, and I see it looks so good, and we hope say in the next years down the line we will still proudly say yes, we've maintained this and all am well. But now so I want to welcome the Minister of Health, Dr. Austin Demby, now we studios this morning. We can talk about the progress in reducing maternal mortality, how we could sustain that, and generally the health sector, within the programs, the challenges, and within a government plan, for make healthcare more accessible, and for we were not able to travel for go overseas for healthcare. Good morning, Mr. Minister.
Morning, Lamrana. Morning to you, viewers and listeners.
Yeah, it is a pleasure having you this morning.
My pleasure, my pleasure. This is incredible,
I know.
Yeah, it's just nice to see somebody like you just bring you A game to the table,
Thank
the
you.
professionalism and the expectations, say we'll see truth in its real form. So congratulations.
Thank you so much. Thank you, and thanks for being with us. I want to start with you on the major issue we want to talk about. So they can talk about the maternal mortality and the new facility, but generally, there is this conversation about drugs, and we see the ministry with the National Public Health Agency and other partners, them, don't they come out again, reopening the rehab centers, and as well push community engagement. But generally, as a minister, I remember a long time ago, it was at AYV when I spoke to you, and you were talking about we need to understand the science behind this and data. What is pushing this? How will they happen? How then they go about for do this? What's in your assessment generally of which we get presently which we in this country?
So, Lamra, that's a very, very important question, and I think, say, for me, one of the big challenges that we'll get now, where will they see this like a health issue? This is not a health issue alone. This is a societal issue. You need everybody in engagement. You cannot treat your way out of this. You cannot rehab your way out of this. We get to look at a comprehensive 360 approach on the supply side, on law enforcement, on the social services and health as well. But more importantly, the community, the society. Because again, if everybody not come together, you're not going to ask what's in Lamra they do, what's in government they do, what's in doctor they do, what's in nurse they do. You have to ask yourself. What thing you to do for yourself, for your family, for your neighborhood, for your community? Again, where people they can say, oh no, we fought Ebola, we fought Marburg, we fought COVID. You look at like health issue, but this bigger than that. This is now all of society engagement. And as I said, the president will talk to that one in the so I'm preempt Danny. But I think we're in a situation where we need for this something very, very profound, something very, very radical, will involve everybody. Everybody. I think at that kind of stage though.
Yeah, the health aspect of we've been get Dr. Jalona the other time, get Dr. Carol Lebo, and then talk about the health part of It's they say addiction is a problem. It's now like when you get malaria, now like when you get other diseases them where they affect you. But one of the things that where the president's been talk about, in an address where he declare the emergency. Now how we go ensure say we give health care services to this as well. As a ministry in that aspect there, we see the psychiatric hospital, Dr. Jallo bin did it, and they try for see how they go admit more patient them. What's in our own approach or intervention into this?
Again, the question no more, Lamrana, you cannot treat your way out of this. Yeah. Elect Amos Hospital not open. Elect Amos Clinic will not open. If you not go and address the supply side of it, it's going to be an endless battle. So for we now, you get two levels. You get mild cases, then we get engaged, where you need to create a social support service. You create a rehabilitation center for them, for support them and get the minor cases managed and reintroduce them into the community. So you get Boku site then when they're not open exactly for that. For advanced cases, we need psychiatric care. Then that make you get Kisi Mental, you get other services that we don't create way for able for help them people in there. One of the biggest challenges that we'll get, if you admit some of them people are with them behavioral problems, with addiction problems inside the hospital, they're very disruptive. Again, if 1, 2, 3 cases they can't inside the hospital, then they thief people them, then they upset the other patient inside there because they can get a special situation where we need for handle differently. So, as I say no more, let we address the supply side, let we address the introduction side, even as we do look at the treatment and care. But anyway, I think the president will speak to all of that. Let her know preempt.
Okay.
Point, yeah.
Well, we look forward to that. Yeah. We look forward to that as well. But finally, I will ask this question on this. It's over a year ago when the president announced this. From my own perspective, I remember my first time meeting you was during Ebola.
Yeah.
I could recall the BBC Media Action organized a training, and you one of the people who have been come address we as journalists them and help with the training. Yeah. I know your background in responding to public health issues and all of this. Yeah. A year ago, you think was it that we let we guards down, or we not pay attention to this fight seriously?
I think we pay attention to the fight. We take them very seriously. But when you fight battle, you get for understand the enemy. Yeah. Again, if you create clinic there, you create site for psychosocial support, then you constantly, for every 10 we you get about 100 they behind them. You take the 100 out, 1,000 they behind. You will never win that battle. So again, I think we need for us a nation. Nobody they make synthetic drugs now. They're imported products. All the ingredients are important ingredients. We get for go to the source and shut down it down. We get for make sure every community get an activist organization for not on my watch, not in my neighborhood. Until we get that kind of approach, we all man they come together. We they say, I don't know what they go on at Freetown. I know what they go on at Truth Media. But now my own neighborhood here, they bring down the kind. Yeah. But they see people they own picking them, they go sell the product. The other day I see them say, Granny, all involved inside. So you see, this is not deep societal issue what we need for deal with.
Yeah, and I was telling someone something like Granny, then I want grand picking can get and say, Grandma go to sell this for we. But there's this other issue about controlled drugs. Issues about tramadol. Where a lot of people they say they talk about cushion, but tramadol as well.
Yes.
And the pharmacy board responsible.
So the pharmacy board they regulate, the pharmacy board they track, but the pharmacy board not to law enforcement. So again, we all need to come together. For all we know it's in the active ingredient, for all the product, for able for verify and give people then license for import and manage them products. Now one thing, but if people then they bypass the law, then they go beyond, then they go underground and bring them product here, introduce them in the market. The pharmacy board go able for fight them, but they not get all of the wherewithal for able for go begin investigate, look under people and door, look every ship where they come, look every product where they come. You get forget a combined effort with law enforcement, with the drug task force, with the community, with the ports, with everybody for work together for say we will stop this from coming here. They want not to not a regular product that way they can through the system.
Yeah.
Then they bypass the
Yes,
system.
yes. And I agree with you that we all get a role for play. And
Yes.
hopefully we will wait for you from the president.
Yeah.
I'm sure he will re-energize we as a people and as a country follow continue this fight. Doc, this weekend the president been get a very busy weekend. You know, one of my colleague been they say the president will be they pull out stories them with the activities in Kono, and he was saying the president gets a very busy weekend and we self gets a very busy weekend because we have to do these stories them. Yeah, but we see, you know, in Kono, like the president said, that is known for diamond and the minerals. But this weekend it was different. It was about health. The Paul E. Farmer Maternal Center of Excellence in Kono. How it come about?
Well, this is a very, very intriguing and interesting story. You know, the president, visionary president. You know, they give me 5 minutes for talk. We not go begin recount all what they do now. But the president, now visionary person, we say, look, we want a Sierra Leone where Bela woman not for afraid for born picking. And you want a situation here, if you ask anybody, any Bela woman who stay the born, then they afraid for say, because they know one jinx them, yeah? We want to reverse that. With Bela woman and Belen are something we really need for celebrate and deliberately work towards the woman in safety and the baby in born one safely. So the president get this vision. So in fact, we try for translate and say not to the baby no more, not the mama, the baby, the toddler, till he go school, till he turn adult, till he turn senior citizen. Let's look at the whole life stages approach. So you get this, then one time in the US, he meet with Paul Farman at MIT, Paul Farman at Harvard. Me and Tom been on the walk all this while, they tell you they Haiti, you know. So instead of get this world vision, say, look, you know, healthcare, not to something where you go begin ration based on usai person born, usai person day. Healthcare na healthcare. You can forget the same quality healthcare where you get in America or Europe, actually they get Nigeria. Yeah? So here the president they meet, then get one word, they say, we'll do something in a salon. When the president come back, actually they appoint me minister on February 10th, 2021. You know, by March, April, me and Paul begin talk. So Paul said, look, we can break ground on this facility. So the mantra for that is, look, you get two choices. You can go mediocrity, do half and half, or you do excellence. We choose excellence. So for nothing now, with the raise money, the government put about $7 million towards that, you know, in co-financing and grants payment. Even me picking everybody involved in raising funds for partners in health. Partners in health then get a reputation. But the name really say everything, partner. They know they do something no more. Then therefore join with the government. So together, now we all put one word, so let we build this center of excellence. Unfortunately, exactly 1 year after that, Paul Farmer died. So we get for renewing effort, say in the name and in the honor, we go build within this vision where he and President get. So now that work now don't see so we can culminate in this opening. So this weekend, Paul Farmer and wife been there in Widow and come for the event. You know, so again, it's so apt for we name this place the Paul E. Farmer Maternity, whatever, Center of Excellence. But this is a joint effort between government of Sierra Leone, partners in health, and the people of Kono. The people of Kono then deal with this every step of the way, from the Sansane. In fact, even when Koidu Holdings shut down, the people then go, they work with Koidu Holdings and the government for remove some of the granite that will be with them non-promissory for bring on the site. Let them continue the work so the work now will get interrupted. But Lana, waiting people will not be able to see yesterday, not only the physical structure, but the kind staff and the kind staff training. The Sierra Leonean and we did it. One more Bobby Nedo will say, Mr. Sisse, we, if you look the old hospital we been did, yeah? Ibindidi, that guy did ASEAN 2021. Prior to that, 10 years prior to that, every baby we born weigh less than 1 kilogram it die. Any baby less than 12.2 pounds, it die. That body in that hospital there, it take oxygen with nurturing, it they bring them baby then they to life. By the thermometer, about 96% of the baby then they survive. So this weekend now,
Sierra Leonean.
Sierra Leonean, this weekend now, we can give him this kind of space. I mean, he was in heaven, you know.
With all the equipment.
With all the equipment and all the support. And you know, Lama, not only that, what you they do now, hub and spokes. Which you see now the hub down there. You get surrounding satellite clinic them where they do similar things and able for refer patient and now to the central location as need be. Then get 3 surgical theater then there with all the bells and whistles. Then get oxygen, then get air, then get suction piped into all of the room them. Then get about 122 beds, then get for expanding to about 160 beds. But not only that, I mean, the old hospital, we don't upgrade them. So we ultimately know we get new campus now where they go from 40 beds to 400 beds. And again, the West African College of Surgeons don't recognize this. So now training inside again for pediatrician, for OBGYN them, for residency them. So we're so glad. We're so glad about this.
Yeah, and this thing don't get a lot of conversation, mostly online, you know. Is this something where una inherit, it's a plan that una inherit and build upon for implement, or it started by the president?
So this was started by the president. This was started by Sierra Leone. Yeah. So again, this is not an end in itself. We want to recreate this throughout the whole country. So right now, even with the resources that we'll get with World Bank, you know, with the work for see if we can do something similar now Bonth, we do something similar now Carine, we do something similar now Waterloo, yeah, so we do something similar now Tonkolili. So we expand the principle behind this for ensure we're able to get this kind of result or the city. So again, I don't know why we waste with so much for would I bring, would I not bring. Now we get one of the best facilities. You can compare this to anything in Europe, anything in America, anything in Australia. Now, Yaso, what you they show so, now proof of concept.
Okay.
So it's possible for there. And with people they talk about sustainability around that, we not just pull their equipment and can drop them. Not just pull the building and can drop them. Now, homegrown talent, you know what in Arana? 65% of the workforce will build a facility. Now, Umane from Kono. Now, Umane from steel bending to electrical to concrete pouring to the actual structure to the design. Now, Umane. You know, in fact, we try to encourage them, let them build their own company, you know, for do this kind of work throughout the country. So in a proof of concept, now an idea, we deep, not to flash in the pan, now something we want to do throughout the whole country.
With this partnership, is this a facility where now we generally get for run? It's PIH then part of the partnership
So PIH the relationship, not a building company. Yeah? PIH now the relationship then they now make, you know, then they about 11 countries then. But Salon are their favorite country. Yeah? Not to building company, not to equipment company. Now organization, international NGO we believe say healthcare now something we can build for the people there as a right. And the way we then do now in partnership. So there's a lot of trainings. I mean, the other day I find out one of the critical care nurses them inside there. I mean, village come on Nigeria, you know. You don't go train in Japan. You don't train in US. Now, it didn't Corona. It explain how for save baby in life with they in distress. So if you go through this facility, they walk you on a journey from where you pregnant, waiting for do for you, where you ready for born, waiting for do for you, where you the born self, waiting for do for you, we don't done for born the pikin waiting for do for am. Waiting at the role of the family, waiting at the role of the husband. How you go able to help the woman during the pregnancy, take it deliver, take it go. So again, nanny na something we no need for do an economo. It need for the Kabbalah, it need for the Kenema, it need for the Bond, it need for the Western rural, it need for the Western urban.
So
as
those are
well.
the question and they were asked about accessibility, with it being in Kono, and the facility, like you say, for now not get another part there. So it's open and it's accessible. People then can refer patients from Fitonya today, right?
Right now, people in the before this year begin up itself, people in the Guinea, then they Mali, then they in Liberia for Kankono, forget the services they already did. But like I say, Lamra, services not to equipment, services not to building. Yeah, what you they try for do now, forget the same quality of service throughout the country. And like this one all gets to na Lumley, the Julius Mother Bio Pediatric Center of Excellence. Now, a good example, they tell you the kind of thing they can begin to do. Right now, they build one hospital now, Karine. They build similar hospital now, Pujong. They build similar hospital now, Moyamba. They can break ground on building state-of-the-art hospital here now, Kerrytown. So now that kind of thing they do throughout the whole country. But we not reach the now sample no more public see so. But this sample here, it give you hope and confidence.
And the quality or the equipment again for be same like this.
Of course. And what's happen, Lamrana, we go through a very, very difficult global financial challenge. The U.S. don't remove about $53 billion from the global health economy. Yeah. So all pull from WHO, So all they want all the implementing partner they open they see around most of this funding now from the US government indirectly. Yeah. So all that they don't dry out, yeah. But what you don't see now, say some private foundation and some partner then they will get resources, but they only deploy them resources there and are placed within CCA, you will get return on investment. That they're serious about this work. So what council have been delayed small bit. The president will go Onga. He get one-on-one with Ajay Banga, the president of the World Bank. He put in a request for let Sierra Leone become one of the few countries them within they consider for a compact. A compact where they say, look, what you want to do now in our country for well-body business? Now lay out a plan for you, for the whole country. We defend way now for bring all partners together for support now. So we see example like what you will see in alumni now. So it they empower people then for let them understand say if we support Salon, what you will see and so now we'll see throughout all the country. And the thing about Anamrana, not so word of mouth, not to see no more. The data is extremely powerful. Salon get the sharpest drop in maternal mortality in the whole world. Salon get the fastest increase in immunization rate in the whole world. Salon get the fastest drop in zero-dose children in the whole world. So all that they happen, say there's something they go on here. In fact, just before I come back, I meet up one with colleague. The important thing now, if you want to do something, you get to be able to see them, you get able to measure them. Otherwise, no opinion no more. So right now, we get strong data-driven interventions. First time they do that DHS survey, demographical survey, every 5 years. But by year 4, all what happen year 1, year 2, even do nothing more. So now we shift to real-time data so that we know what's happening at each and every district, each and every PHU. If somebody died today, we didn't know about them. We didn't know what make it die, what you would not do correct, so that all the other pregnant women every day, they're not go able to get the same kind of fate. So we get watch. If you go New England, so we don't create a situation room there. We don't get Starlink and communications capability. Now the district them. Every morning we check see how many Bella women I get. How did they do? how many of them are high-risk pregnancy? What should they do about them? If we lose anyone, we didn't know about them. We dey collate wetin dey happen at the whole country, and we say, next week, what should they do for make sure say this not happen again? So now that kind of level of sophistication would happen now.
How we reach to this point, there's this good news about Sierra Leone and in maternal mortality. So the way the data then they come out, we all they say no, it's so bad. And now there's this good news that we don't get to this point. How did we get to this, and what's in the plan for sustain this? To a point that we go reduce to a point where we say nobody no go for go born and die.
You see, Lavada, we hope, not we hope, we strategy. Now, zero preventable maternal deaths. We strategy, now zero preventable infant death. The way we don't able for can so far, now for say, first, let me create a system where facility then they're available for able for providing services. Let make sure say you get the staff and staffing complement. We train, we able for, we want to stop all the home delivery there. People don't let they deliver now us again, because again, they say, we don't need deliver now us from 19 Jubilee, which they can't tell for do. But if you dey deliver the picking and come out first, we don't know waiting for do. You dey risk my mind life if the picking food come out first, well, you don't know waiting for do. So now when they say no delivery at home, then all the kind of the facility, we make sure say the facility they're ready, we make sure say they get the staffing complement and we don't get midwifery training, we don't get direct entry midwifery training now. We get trained OBGYN, the first set of OBGYN specialists, the home trainer, then go take the West African College of Surgeons exam, 100% pass. So we build all them kinds here, so and we don't begin see the result them like this basic obstetric care unit. We make sure say that they all over the country, comprehensive obstetric care unit where they begin get additional C-section capability. We build on it throughout all of the country. So as all them here they go on, now so you see the numbers they go down dramatically. But what's not happening now, Lamana? Let's be homegrown with two DSTI and the Sierra Leone people would develop a brand new app with the whole world the big way for. This is an app where the first encounter where you get with the facility where you're pregnant, with the register the pregnancy. You can register on your phone or the nurse then will register. And you get a complete profile of the woman. You get a complete health situation of the woman. Normally, you get 4 encounters before delivery. We then expand this to 8. At every encounter, we look for, say, waiting at the comorbidities. You get high blood pressure, we manage them. You get diabetes, we manage them. You get sickle cell, we try for manage them. You get any other comorbidity, we manage them. So we not get surprised where you can deliver. So if you get them kind of encounter, then no surprise, no day. If we see you get twins or you get triplets, we don't link you one time with the OBGYN. We don't make sure say the ambulance day, and now they get community care worker them. With the deal with the pregnancy, with the monitor the pregnancy, with the support the pregnancy. So again, this kind of drop or don't drop. Now the easy part. In fact, the data where you get, this drop from 717 to 354, now 2023 data. We don't even see the 2024 and 2025 data. If you see her, you self go gladly. But we don't want for announcer because if we announce and they say, but I mean, this thing again.
No, it's good news.
One let WHO, the other independent people, let them can look at, let them announce them. But it is very impressive where every Sierra Leonean for be proud of. The health work people, even themselves, although not perfect, some people and they will still try for manage. But when you go tell somebody, say, now you clinic for the past 60 days, you get 0 maternal deaths, you get 0 preventable infant. You just see what they neglect, then they redouble their effort.
Yeah. And so, outside the free health care, which role did they play in this?
The free health care, they play a critical role because the free health care, they look at commodities, and we don't say all pregnant women and lactating mothers and infants, they benefit from the free health care commodities. This is now a partnership between the government and the development partner, and mostly UK. the idea now then for buy, we said buy, but then for the reduce then contribution was with the increase with contribution. But at the same time, we don't expand the pool. First time I've been Kumbuare no more and picking them now. We say the disabled and other vulnerable populations, they're all for benefit. So the pool don't expand. So they try to find additional resources for able for boost the free healthcare. But right now, we don't improve the delivery of commodities. First in a one term, then they deliver for a year or something. Now they deliver every quarter. Again, the only thing I will get for monitor now for make sure say we don't deliver them, it actually go to the people that we need them.
For benefits, yeah.
So the side, I think call them donuts. We get small donut hole on this. Because actually give the free health care to pregnant women and lactating mothers and infant them, me and you will not qualify. But we still need health care.
Yeah.
How for access that? So what you don't try for do now, not forget, private pharmacy there, we with the vet, we don't go through rigorous standards. We will place them inside the public hospital so that they make them drugs available for you at a reasonable price and meeting standards. You know, they store expired drugs and all of that. So you get the free health care and then you get the cost recovery drugs inside it. What should they try for do now for say how you go boost this up a little bit more so that you know with the Lamrana go pay for in your health care because sometimes the Lamrana will get major health crisis where it will be a problem. But now we pool with resources. If everybody pool their resources, then not to all man is sick at the same time. You be able to use that resources there for cover people that are sick. So they get the social health insurance scheme. So we don't work on this for quite some time. We don't get to a point now where we're ready for launch and fairly soon. So that need to go supplement.
So that is the idea of every citizen contributing
You
to a
contribute.
scheme.
Yes.
And then they go use for take care of.
Yes. Because what's happen right now, all my are free. But it go free to you, but somebody get for pay for them.
Yeah.
So now we try to raise revenue. And the other thing we look at also, since all the international donation and they dry up, and the other thing about the international donation, a wake-up call for we. Yeah, we cannot depend on other people, and because quite frankly, again, with them they bring this then donation income, that then they determine whose side they go, whose district that they go, who that they support, whose NGO are they. So all them different things they go. Now they say no. The government set up a plan. We get a strategy. NGO or partner you come, you want can contribute to what you want to do. So again, if we begin raise we own revenue, right now about 11.6% of the resources they go to health. 11, that's a huge amount. Yeah?
But the ordinary Leonean is when not under free healthcare is even paying a lot of money
out
for
of
health.
pocket.
Yes.
Out of pocket. So we want to reduce the out of pocket expenditure. So what you want for to try to do, how you go raise revenue again? We all NCR don't they die. But we get to look at things. The slushy, this health insurance scheme, that one thing. We work with the Ministry of Finance and then we international lending agencies for say, look, why we not do debt swap? Right now, close to 30% of we income we spend now for service debt. So they say, well, look, we don't really need this money. Why this money? We put some on health. Low, we get well body for all man. We do that and then at the same time, we want to look for other ways for raise revenue. Now we get Sierra Leone and they live longer. But then they live longer, then they get more chronic diseases, more diabetes, more lung disease, more cancer situation. We need to prepare for the one in there. So the best way for prepare for them, now for begin levy taxes. For example, most of the obesity and the chronic diseases is associated with sugar, the pasmac sugar. So therefore begin tax sugary drinks for create revenue, for provide healthcare. Most of the chronic chest and lung disease, in fact, a lot of you get over, I don't know how much thousand toxic chemical with the inside cigarette. Yeah. So if somebody get lung cancer, for manage that one day, it take the resources of over 3,000 people. Yeah. So why we not go put small levy on the cigarette so you generate revenue? If you combine the tobacco revenue with that of the sugar revenue and salt intake, salt line, because all the high blood pressure now. So we tap down and you put all on it together. We don't begin get sovereignty. We don't begin get health. So we don't
We go
begin
spend
raise.
by
We
ourselves
go
now.
spend by ourselves now.
You, with your background and your experience, spending a lot of time in the U.S., you get this idea of health care should be paid for by the person, should be expensive, or it will be a right and accessible, and accessible to, especially the ordinary Sierra Leonean.
So, Lamana, the staging of the question are not correct because this is not a U.S. business. This is a salon
You know, but
business.
the U.S. people most times can say,
the health
I know
system not
pay,
work.
yeah, they pay a lot for health.
The health system not work. You know, it's in, Lamana, then they pay $11,000 per person. $11,000 per person. The UK they pay about $5,000 per person. Salon would they pay $46 per person. Yeah. So
That is
now,
what the government pays?
No, the government
Or
is
what
paying.
the citizen pay?
No. The whole healthcare expenditure now about $46
For one
for
Sierra
one
Leonean.
person. Yeah. So if you go bang here, if you don't pay Okada, you take 50 people and their own contribution for that. And so what do they try for do now for say how you go able for best utilize this $46? The government in contribution to that, unfortunately, if the economy grow, that 11% they go be meaningful. But when the economy is stagnated at this point, the 11% not that much. Now make we go out for bring other people in for help we out. But if we're able to combine this with domestic revenue generation, this will 11%, it will become much more meaningful, much more tangible. So again, we want to raise that revenue there. So as we offer
What would be
free
the
healthcare,
ideal, say revenue per person?
the ideal, because right now I think say they over about $75 per person, yeah. But if we're able to raise them from 46 to even 55, it go nice. And Lara, this health insurance all they bring cancel, now for all man. You know, you self now, so you go say, I go sit down now, so I say, how many people are in my village, you know? Every time somebody hear that in the camp, you know, in foot arts in the camp, sometimes in foot no arts, if they say, me foot there, send money for me. If you get this insurance scheme, where sometimes the premium now 200 leod or 300 leod or even 500 leod, you can able for support 100 people them for the year. So anybody who is sick, you don't need for call Lamrana. If you go normal with a small card, you get all of the services where you need. Because we need not to all man the sick at the same time. So now really great idea for generate local revenue.
So the idea is every citizen pays an amount.
Yes.
So a basket fund.
Yes.
And out of that, could it mean citizen can choose, say, okay, me go pay this amount, or it's by earning?
Now they get basic premium within the ask for. So it's just new. So it started new for. So we'll start with employed, official employed people. Where you go say, "Oh, take out of your salary you want them." Then you go expand that to the unofficial people. In Rwanda, they get 98% penetration. Yeah, throughout the whole country. And Senegal and others, they get very, very high penetration of this work. But what's happening now, they begin pay for your own health. But when you pay 1 cent for your health, even though the health, they cost 50, when you pay that you 1 cent, you get power. Nobody they can begin tell you waiting for do, waiting not for do. Again, we don't want to let them abuse the system. So you go get small co-payments where you get for able for access the system. But again, it help government for pay for services. We feel say healthcare now right for all man. The government in responsibility now for create a safety net so that nobody not fall between. What would they also do, Lamana? For the past 45 years, the government and all with development partners, they don't insist on primary health care, for take health care to as close to the people as possible. And all the development partners, if you say hospital, they say, no, we don't mix banana. We'll get PHU them. So we don't do a lot of PHU them. We get about close to 1,600 healthcare facilities in the country. What's in that don't do now, it don't create access. 85% of the population get access to one facility within a 5-kilometer radius. But what's not there beyond that now, the quality. So now what do they do? They work on the quality through infrastructure, through staffing and staffing complement, through supply chain and drugs. Yeah? So 1,600, you can't do that overnight. So they slowly work towards, so for example, on the energy front, Connaught, you work at it now, then get 1.2 kV megawatt.
Yeah, it's say we hear say lights go there.
Yeah?
It's say we get a news of lights not there.
Because what happened, the thing about it, if you're not hearing news, that's good news. Yeah? Because now, imagine you get 100 kVA. You now say, no, it's 100 kVA. If you get 12 of them, then at one place, and they supply electricity 24/7. No machine on the where you plug inside where they cause problem. So now we get about 380 facility, including 18 hospital them. They don't completely get solar solutions, you know. And we slowly work we want by 2030. Not only the 1,600, with the expect the facility is going to expand to 2,000. So they plan for 2,000.
Okay.
Yeah,
You talk about accessibility, which is very important, and we've been talk about sustaining the maternal mortality rate. You get hard to reach communities, areas. We don't see ports of Usai and get for put Beleuma now, Okada, and go. How people them na communities them where sometimes not get the help with the STI produce or accessibility to the
remote side,
area them very difficult. So how do they benefit from this?
So Lorena, that I've not been done with it, but please be mindful I come back. So the complement to primary health care. But what's happen? What's they make you to get in crisis when they bring people in Canada with bio? Not to the pregnancy per se, yeah? But at the fact that then they wait stay crisis day, we all thing undone, now the thing in the rush for come. With this new system we don't get now, this app not to but the telephone coverage done they all side now. Yeah. If you they get SMS, you go able to use this app we get. So the idea now for make sure say even in remote side them, you get community health care worker there where they work with the pregnancy. And what you want to do, Lamrana, for we effort for look at the solutions. Yeah. You don't want in the last 4 or 5 months, you don't want to hear people then complain about ambulance.
Well, it don't reduce small.
It don't reduce dramatically.
Yeah.
So now what you they try to do now for reinvigorate the ambulance service, not only one get green ambulances, where you get hybrid ambulance with solar powered ambulances, the way you go able to distribute throughout the country. We want motorcycle ambulances there. We were able to go on a remote site that we're able to go on a far reaching side there. But not only that. Pregnancy not to labor and delivery no more.
But the understanding as well, though, is very important at the community level.
The community. Yeah. So you will get navigator there now. Because again, hospital na last resort. Yeah. You get navigator now with the day inside the community. If you get one, so this new app will get, if you don't register your pregnancy, it'll link you up with a community care worker. A community care worker will go meet you. Hey, how the belly today? How you get mosquito net? The beginning they're all covered with mosquito net.
Are they in every chiefdom, every remote community?
They expand the number. So this number will get, I think so we'll get about 850 right now. This new World Bank Compact, because it's easier for hire them. You know, we pay them maybe $100 a month or something, you know. That community, first in our volunteer, but you know we'll do this as volunteer no more forever. So we expand them. We expand and make sure say every village, every community get the community healthcare worker. Not only for Beleuma and them. We will handle malaria, we will handle mpox, we will handle measles. It did it for able for support the effort. The other thing I want to talk about, Lamrana, as we do this primary health care, the side way we not be not invested, na secondary and tertiary care, the hospital them. So it is busy now, if you get the best primary health care, if you get a breakthrough, if you get complication, the landing zone not strong enough. So we talk to all of the partners and they say, no, it's too expensive. No.
Then I don't they want go.
They are done the one go. So what should they do? We did double down on the primary health care, but at the same time, we did invest in secondary and tertiary care. So if you go look now, first term, now about 50 doctor, 30 to 50 doctor, then they train for a year. In the next 2 years, we will begin showing 250 to 500 doctors a year. Yeah, we did look at the specialist training. Right now we get about 150 residents in training. So we not only train the workforce, we not only expand the skills. The other day, I got one story for tell. Anytime you meet Cuban them, then they tell you, wow, you're from Sierra Leone? The best cardiologist in Cuba is a Sierra Leonean, yeah? So we sit down in our office the other day, they say, this guy the Cuban guy don't come home, he don't come back for can stay home. So I sent somebody for go check this guy so that we can introduce him. The guy he come by, say, no, the man not carry it. And one young guy now we see outside, not to the guy that. It turns out this young guy is the Sierra Leonean Cuban trained top-notch cardiologist. Let's come back home. So the then kind of people in that would create the space around them. The other neurosurgeon, we don't come back home.
Yeah, I see that story.
So now we build Connaught into a top-notch tertiary hospital. We renovate all of the theater that we did. We empower the surgeon and we come back into service. In fact, we just don't buy 2 CT scan them. One for go Connaught, not to the basic CT scan them. Usually they're 64 cut. This one now 128 cut CT scan, the highest resolution in the market right now. Now they bring Connaught as a public thing.
How do we build trust in the health system? Say from primary health care up to tertiary health.
All right, now we walk down there. Now we major problem down there, because I think people they not lost confidence in the healthcare system, But even when you get all them fantastic data, so you go tell person, then remember, I go Connaught 2 years ago, now that kind of nonsense, then they did not aid. So now we get responsibility for change down there. People then they get accident, then they rush go emergency hospital because Italian and they say that they forgo, You go the emergency and they say, go Connaught. Because now they're the top orthopedic surgeon in there, They can go Mami Cook and other place there, but here now they're home. So we build this Connaught. Right now. The burns unit is nearly complete. We work with Leone Co. and other partners, and we build around it. And again, I think in the next few weeks we will commission the CT scan. The CT scan we'll buy 2 with the K1 go Kenema. Again, for just show proof of concept. So beaucoup the expenditure where people they make now for go overseas now diagnostics. Yeah. So why do the diagnostic here and save you the trip, the journey of all that? And with the build the specialist care. If you go Joy now, with the build this multi-purpose building, where they sit about 1,000 students, the lecture theater, then get suite them, where you go for do carry on training. Now, Lakaya, so they get the postgraduate institution. We'll talk to the president in Paddy. They don't give about $4 million for do that. They give you another $4 million for build this facility. So they build the workforce.
Yeah.
As they build the workforce now so they build the institution and so that they will get landing zone as they
that's
qualify.
that's the point again. And with all the efforts and then investment there in the services, sometimes you talk about equipment where they come. If you see Puel, we don't done. Somebody share photos of the Chinese hospital na recently. The wash facility was so myself drive past the fence of the hospital and in McKinney the other time we run this story about the wash facility people need to go to neighbor and all. How do we get the hospital for be a place where we all go be happy for go, not get worried about say like going to one private hospital or one then Egyptian hospital where they
Yeah.
are.
Now confidence building. The first car, so I go Maburka, as one of my first visit them. We sit down, they talk. Now I tell them, say, oh, I use the bathroom. They say, oh, the public bathroom there. It was the cleanest bathroom I've seen anywhere in the country. So this now the MS, the DMO them, the staff them responsibility for own the space. Not so you building go fix something like that for you. Now own yourself for really own this place with pride. So what you will try for do now for ensure say we not only empower the MS them and the DMO them for own their space, we get competition. So that then we will compare amongst themselves. I want to see what you see now. My broker, any side I go, I tell them, and not so only my broker for maintain the standards we not set, but for other people, let them see how my broker they do. So again, I think now process with all of this kind networking capability we'll get now. We'll go able for talk to people at the same time. We'll look at how for good get process improvement. We'll figure out a way for acknowledge people that way they do well, and we're able for admonish people that we know they do well. And we roll in all of this as how I can tell people in the ministry, we're not a referee, we're not coach. We don't want to know if would I win or would I not win, would I do well. We want to let people then do well. So we try to do everything we can for support them for able to do well. We need for regain and reclaim public confidence.
And on that point, there is this proliferation of a lot of health facility. This hospital, and they called hospital as well, and if you can look the side way then they, you begin imagine. Also, health training places, nurse for train nurse and other people them. Waiting at the ministry role in this, in regulating this sector.
It is very, very important because even with the nurse and midwifery training, we get a new chief nurse and midwifery officer, just really brilliant lady. At the same time, you get a council. The council are the regulatory body where they regulate all of that. Again, in long years of uninvestment in their space here don't make people just lackadaisical about what's in the apple. We did invigorate that. The medical council, like Ministry of Health, then they go tell person waiting for the waiting regulator. We get a medical council. We get responsibility for regulation. Now we need for empower them. We need for equip them. We need for digitize them so that you're able to see every facility. We need for able for inspect them. We need for able for certify them. This BNTM, we're so preoccupied with the public sector. We need the private sector for kind, but we're not include the same level of regulatory oversight for them as we do in the public sector. That need for change, and the way for change I'm not for strengthen and invigorate the regulatory arm within the medical council.
You mentioned the number of doctors them who they get. We see the ministry just announced recruitment of nurses as well. The issue about quality and come with confidence and trust as well. If somebody the attitude of people in the sector, the workforce, how that's important to the type of medical service who they provide to the average Leonean.
So that now we see on display this weekend. That now we see again people and they look the equipment, they this, that, which you will see now corner. Now how staff then care for, then show empathy, then say, this na me bella woman, how for take care of her. So we not only look at the skill set where they train, we look at attitude and relationship. And it look like, say, we get for do that pre-service, people then learn the ethics of that before they even graduate. The one that we don't graduate now, follow we impose on them. Because again, that teamwork. We want nurse go, he misbehave, he do something wrong, he reflect on everybody. And my sister now being matron, now cannot, I've been retired at Fubi College. I've been sick. I've been get Hep A or so, so they admits me na Connaught. When my sister they come in the morning, cope, they wear clog shoes. And they announce in presence. Every nurse, everybody they run to the station, everybody, so you really they in charge. Yeah? I think Senator Danny now don't lose small bit because the nurse and they be too friendly with the people and not able for the matron and too friendly with the staff, then they're not able for impose on. The matron, you and your staff, not to party business on the part. Now professional relationship. If somebody do well, you go able for admonish. If you not do well, you go able for chastise them. And so now I make this recruitment business all they do. First and then they say, oh, we need PIN code. First time the PIN code na Uda Sabi Udat. Yeah? And me you know go to work now one place. Yeah? I don't de amosia. I de dedicate myself, I de do my very, very best. Yeah? All of a sudden somebody come, we just come out because he knows somebody's on side, he get PIN code, me no get PIN code, we sit down at the same workplace. It they undermine esprit de corps, it they undermine discipline. So I think I will get bad name for this, but I'll not be seen. We they stop that process in a meritocracy. Everybody for compete. So right now, we get an additional 3,000 PIN code that they give. We set some clear criteria for them. We get a system where people and they register online. You don't need for nobody. I mean, the past they watch. Everywhere you go, you believe, see people in pass with brown envelope. Even the security guard and they take PSC form them from people. It is completely unacceptable. So we go through an electronic system now. They say you need NIN number. We're good for NRA, yeah? Because everybody, irrespective of in a village self, you forget NIN number. So you don't put pressure on people and for get NIN number. We get satellites linked in all of the DMO side there. Any side you go, you're able to sit on there and fill your application. You don't need for Sabi, nobody. The system, if the vet owner, if you get certificate, it falls, the system they pick up, it push you come out of the system. So we screen down until you get a smaller group of qualified people then you interview them for see now if they're able to really do the job, and based on that we're able to deploy them, and we do them by district, by ensure say every district get the kind of requisite. We do them by skill set. Yeah, so not to Uda Sabi or Uda not Sabi. In fact, I prefer. Yes, nobody know. So people in the talk, no, this is about me cousin. No.
Then he reach out to you.
Hey, and I tell them nicely, politely, say if you really want to let your person do well, encourage them for put in a good application. But no can't say with the Fed corruption that you want to let me for go give you person a leg up. We create a level playing field. And so far, it work extremely well. The next part where they go now and for say, they want that we get PIN code. We make sure say then they're at the workplace.
Yeah.
If they're not in at the workplace, we remove them from the PIN code. If somebody can't say, oh, no, my granny not been well, we do on-the-spot check. If you not did it the way you're supposed to do it, we remove you from the PIN code. You can come back and appeal. Yeah? But if you not did it today, would they pull your commodity?
Since you take up this job, 2021,
Yes, yeah.
Have you been enjoying it?
Arana, also I've been there. I'm going to manage $2 billion a year in multiple countries around the world. I come home every day, an opportunity. I know this year as challenge. I know this year as day. I don't sleep that night. I work 18-hour days. But every day, that opportunity for make a difference. First thing we make decision, a country level decision. Give them 100 million, give them 200 million. You don't know how they work here. Yeah, so 10 Leone. I want to know how it go, how it make people their life different. We call our with development partners. And first in our processes, they say we don't get 200 million, we don't get us, we don't get. No. Would they say, waiting at the health outcome as a result of that investment? Some people say, will they go training? We'll get for, I say, wait a minute, you go to train, on a routine training. No. If you don't train done, we'll deploy you, we foresee the impact of that you training there, who side you go? You know? And why they go visit side them, I know they go visit just the staff no more. I encourage the staff and support the staff. At the same time, we talk to the public. Yeah? Because now the public, now service-oriented institution. Now the public. When we go, the reason why I fall in love with Connor, that first visit we'll visit, without all the additional things, so I'm not supporting anymore. Without all the additional things, we go, somebody unsolicited. We talk to the people, like, and say, I want to talk. You know? We say, what do you want to talk about? They say, I want to tell you thank you. They want to know the way they help you now. Yeah? It make you feel good. This NICU, I say, the neonatal intensive care unit all day. You go other side and the woman and afraid, then worried and concerned. Where we go, Connor, 3 years ago, yeah, and then at Barry, all man they keep comping. Then they keep comping because they just they wait, let them call them, let them go breastfeed the baby and come back. They know say 99% of the baby the way they go inside it, then they come back okay. So are they really enjoy this?
What do you think saying are the big challenge? Because with all them progress, there are challenges.
No, the big challenge na institutional challenge. Yeah, the big challenge na shift in focus, change management. Because what it may happen before, healthcare delivery now being project-based, now being disease-based. So American company can say, oh, one help malaria. Then give them money for malaria. They buy bed nets. All money can now for go do the malaria work. So man can say, hey, nutrition will they pay, you know. So, Lauren, for the past 5 years, what we don't do now for shift the focus. We not only get the best malaria program, the best bed nets, the best vaccine, the best insecticide spray, all the best diagnosis and treatment, and somebody get a nutrition issue and able to address them. So what you don't do now for shift the focus from the project to the person. The person in our unit. So all in Tiana, your malaria program or your TB program, your HIV program, your nutrition, your vaccination, is only relevant if you're able to change the person in life. So they want them to be protect the malaria program. Then, say something, they're not happy or they change. So that been the difficulty, Danny, for disrupt our mindset there. But 3 years, 4 years into the game, we don't change because people don't see the effect of them. We don't change the focus. Now we want to see healthcare for everybody. And how you go able to see everybody? The best way for see everybody, now for follow the life stages. Start with pregnant woman. So the whole healthcare system don't change now. You say, what do we need to do for every pregnant woman? All 350 to 450,000 of them every year for ensure that they remain healthy and then deliver safely. Yeah? So you mean now you program now, if you begin malaria program, the malaria program for relevant to the embelomania, you can set targets to move forward. For the baby now, the baby we don't get interest in the baby from within the in utero. Because if you support the mama, now the baby you don't support. So if the baby comes safely, it don't get no challenge, no difficulty, he born safely, it don't increase in chance that this world. And you go able to work with this baby now from 0 to 60 months. So all them vaccine, all the malaria program, all the TB program, all the nutrition, it directed now at every baby. Yeah?
So he grew up healthy.
He grew up healthy. So not only that now, till then go kindergarten. Well, we then go kindergarten now, you don't ready them for school. Yeah? Till then go school. We then go school now, the health don't shift. They focus on their health for allow them to learn. Till they become adolescent, till they become adult, till they become senior citizen. This new approach now, all man they call it now. The Liberian government then send the whole delegation Kaya. Botswana then send, Burkina Faso then send, for can understudy this. The WHO don't adopt her now. Then they go to every country, then give them a special advisor for look at the life stages approach to healthcare delivery.
This leadership way you talk about, so leading by example is always very important. You use the public health system now?
Lamana, Yaso, the way we they advance, I don't think they need the day for go any side.
You dey go Connaught.
I they go Connaught, that be honest, I they go Connaught, I they go Choi Trams. Yeah. Now the two institutions in there. Because what's happening, you know what's in? People are not aware of that. But Connaught, they get the topmost orthopedic surgeon in West Africa. He did it. Yeah. He's one of the top cardiologists them. Yeah. Dr. Russell. If you go Ghana, you go India, then they say, "What's you come out?" That's alone. What they can't find here? Yeah. So me again, I know show me private picture them, but anytime they go there, I need help, and they go check me heart and check me pulse, check me blood pressure. Again, what you want for do now for use more of that and publicize more of that, so people then go know say the services then they. But what bring a CT scan come? None of the I know say church and then get CT scan I don't call the other place. Then get echo med, then get CT scan. But the all they bring can at top of the line a public facility.
You go wish for see the president self use Connaught or use with
yes,
public health
of
facilities?
course. What thing happen like somebody like president, so you get to be extremely careful, because again, if you rush and go Connaught, it's disruptive. Yeah, all man go, hey, president, call. So again, you manage that. But again, it take care from in Sierra Leonean physician them. Then they take good care of them nowadays. In fact, one of the things that we want to do now for encourage even private sector. Private sector for can open their own facility them now. So would I ever can afford that one pay? We don't want to reduce healthcare to the least common denominator. The government irresponsibility enough for create safety net. Yeah? But Lamrana, if you want to get thoracic surgery, yeah, and you need that now, yeah, we don't want to let you go Turkey or you go Sunside. We'll encourage Turkey then, let them come build now, then make it available for you. So you save you on the transport. Yeah? If you go there now, if the government wants supplement, government can subsidize small bits, but then they're available. But like I say no more, you get under-investment in hospital then. What should they try for do now? For correct that.
Yeah. So talking about that, in 2022, the president, the government signed with a US-based health variant for cancer center. Waiting at the updates on that project.
So the cancer center na Kerry Town with the bill and what may happen? The government being raise money from I think anti-corruption.
Yeah,
so they raise money and then raise some additional money from COVID-19. It comes to about $7 million. Yeah, but for this worker, so you need about $24 million for the cancer diagnosis and treatment center. But this is not important seed money for start the process. But Lamrana, the thing about the cancer center, now the equipment and supplies, because part of now radioisotopes they use, cobalt-60 radioisotope. So this BNT they go back and forth with IAEA. IAEA then get for verify before you do this, and for bring radioactive product in there, so you really get a lot of regulation around now. One of the biggest challenges that we've been getting now for the situation for make geospatial survey for CC the groundwater are protected, and we look at bunkers for not to just build regular hospital. You get bunker where you go for build for allow the radioisotope them for be stable and for deploy them. So we don't get to a point now we don't exhaust all that. And so the last time the president will go Vienna, he talked to IAEA and he talked to other people that we were able to raise another $20 million. So the $20 million plus $7 million, we're really ready for move forward now. So again, I think just watch this space. Kerry Town will be extremely busy. You see, I don't begin changing my dress code first and suit and tie. So now they add hat early next year. The cancer diagnostic treatment center they move forward. This new hospital, about a 250-bed hospital.
Will the president be promised? Yeah, in 2018, the president made that promise. He said he was going to use the ACC funds, recovery funds, for build the hospital.
Then at the cancer diagnosis and treatment center, and then they move forward. In addition to that, we get a $50 million soft loan for build a general hospital na Carytown. This hospital in Lumley, it cost we about $18 million. The hospital na Connaught cost we about $38 million. This hospital at Carytown will be about $50 million. We don't get the money, we don't approve now. With the breakground now for begin build around this. So with the build a new hospital there, with the work on the cancer diagnostic and treatment center there, the other thing that happened at Carytown supply chain business. Right now, all of the drugs and supply what they get, what they saw in some warehouse, who say they keep agricultural commodities and tractors and all that, which is not the right thing. So what do they do now for build a farmer grade warehouse? It will cost about close to $12-13 million. We don't raise all of the money. Government don't pay your own part. But now I don't go big some other party. They will all don't put money together. Then we'll break ground and try for build our facility there right now. The other thing we see now Connaught this weekend. What do you know for go Connaught?
Yeah.
2 miles outside of there, they get the Dorma facility, where they build about 33 crates, 33,000 crate warehouse. Massive warehouse. We're in a farmer grade. We're going to allow you to store all your commodities at the right temperature and right climate. At the same time, we build a student hostel in our Connaught as well.
There's this hospital also na Lumley.
Yes,
the one before this new one we build. What's the status of that?
We biggest every day they pull me here, and I don't get here, I'm here again, because what's happened now, Kuwaiti funded project. We don't did it from 20 whatever, The Kuwaiti funded project, but the arrangement now, the Kuwaiti fund then get a contract to local vendors with independent consultants. So the government not just recipient, we're all in London and Tonangiwi. So you get a problem now between the vendor and Kuwaiti bank. We want at one point they say the government is service the debt and a loan. The government is service the debt, but the money not reach the Kuwaiti bank, so they feel in a default. But what's happening? The funding may go through Deutsche Bank with sanctions. So Deutsche Bank not able to remit the money go to Kuwaiti. So they stop the process. So Ministry of Finance figure out a way for find a new intermediary bank. We then go able for service the debt for go to the Kuwaiti. But a very interesting arrangement because as you they pay the service debt, then they open the window for a very narrow period. If you see una wait stay for pay for the next one, then shut them back. So now that back and forth on day on, it's just so frustrating because what's happening now, you don't get this JMB Pediatric Center of Excellence. Then you get this big hospital there next to them. People in the can and they rush everybody they come at the pediatric hospital. And this pediatric hospital now for more very, very ill special care baby them. Whereas if you get this general hospital now, it will serve the whole community. But me I promise once it'll break the contract, it'll break the rules. Forget about the Kuwaiti. I think it will cost about $1 million for do the physical construction. Then get $6 million in the pipeline for equipment and supplies. But this now something between the Kuwaitis and the vendor. We're not recipients of but again, it's just so frustrating. Every time we
hope
don't
they for
yes,
come over
hope they. In fact, what you want to do now for call the Kuwaiti then and say this is not working. We will still continue for service to debt, but we'll not allow you for just take over this contract and finish this project.
There is another one at Waterloo.
Now 3 days. 1 day Waterloo, 1 day Lumley, and 1 day Macaulay Street. The Macaulay Street, the bottom side now the mercy ship, then they use as the Hope Center. They now renovate a nice one. This 100-bed facility she done there. Now the same encumbrance 9 days between the vendor and Kuwaiti bank. But when Phantom Ali they work on that name, we'll see how for find a solution. We will just bite the bullet. If they need for go court, we'll go court with the, but just break the contract that we done this
Maybe
project.
done and get
Because it will change your life. It means say you don't add 300 bed capacity to the western area.
Yeah.
It will be
You know, the GMB hospital, I've been there with some family some weekend. I agree one they tell in sister say, is they say in Peking sick, she was actually telling her, they can't go na lonely. And they take good care of the Peking and they say that they inside the case. So that the confidence you build in the health system was very important.
So, Lorena, in Liberia and Kaya, the Liberia and Kaya, then go na Lumley, the biggest dream, now if they can take that Lumley hospital, they can go Monrovia. So they say, so the deputy minister, the Hamburg minister, say, hey, your friend Minister Demi, he finished bluffing you. Because the hospital, it just beat their imagination. The intensive care unit. In fact, we're not going to use all of the components of the JMB yet because they build up to them. But, early next year, it will be fully functional.
Okay. Let's take some comment then, some question, Mr. Minister. This first one says, Mr. Minister, what is the plan of the Ministry for the School of Clinical Sciences, McKinney, that's currently training the clinical officers and physicians assistants, middle-level manpower to add in the workforce of your ministry? That is in terms of employment, PIN codes, as soon as they finish course, building infrastructures, lab, hospitals, and more, it's been designed to be implemented, sir. This other one says, what have you done to improve the condition of service of healthcare workers in the country? Another one says, Mr. Minister, there are plans to build a ramp for the surgical ward at Connaught Hospital. The stairs have been a challenge in the settings, and how are surgical consumables going to be ring-fenced? Another one says, please pay the nurses more money so they stop asking people for extra money when they are in hospital. Another one said, this is a great improvement. However, how will the culture of maintenance be developed? After all, installing all infrastructure and equipment without fostering a maintenance culture will ultimately be a fruitless endeavor. Fantastic job, Dr. Dembi. Show them the stuff Cubans are made of. We always deliver in style. Anna from Kwame Yangsin. Alima to say, quality is our problem. Workforce has to change their attitude towards patients. Another one say, Mr. Minister, what plans have you put in place for the closure of the MSF project in Tonkolili, Bombali, and Anga Road in Kenema District, especially in their treatment of tuberculosis resistance? Also, do you plan to recruit their health workers in that part of the country? Lahai Sidibe say, blessed morning. I am Lahai Sidibe, student of Jala University. Say we are ready to help the ministry to explain some of the challenges we are going through as health students. Another one said, Doctor, with all the investment going into our health sector, how can we ensure healthcare workers are truly accountable from coming to work on time, using equipment responsibly, to treating patients with proper ethics and respect? Mr. Minister, I don't know if you are aware of the medical school in McKinney, that is the School of Clinical Medicine in Macambo, that is currently training middle-level health workers. I think the student in that school, they follow me this morning, so they get a lot of questions.
Two questions
for the
from me
minister.
already.
Yes.
Yeah.
You go
I'll
answer them.
try for address them. Again, when you talk about health workforce, hospital, not to doctor no more, and nurses, you get a whole range of people that way you need for train. Not to random training. What we they do, and I foresee what are the need for the country today, and what are the projected need for the next 20, 30 years. Not to light switch, not to just say, Lord, do this today. So what you will do now for forecasting need. So you don't forecast the need, then you begin train towards the need. You actually train towards the need, you look at the deployment and retention. So that full cycle they would look at. So again, the school na McKinney is very, very important because not to all side they get doctor, not to all side they get surgeon, But if you get mid-level trained people, we go able for run center, na PHU, na rural community. It go make a whole lot of difference. It go help the doctor then, free the doctor then for deal with more complex cases. Then they deal with the minor cases. So it's an important part for we. I mean, even in the US, the physician assistant then they play a major role. You they go Bokusa, you not even see the doctor, because again, the physician assistant, they do nearly everything with the doctor. You save the more critical cases them for the doctor himself. At the same time, they train on surgical practice. Again, you don't need to be a top-notch surgeon for go do circumcision or do small sutures or whatever. So again, we get them community healthcare workers, surgeon, and all they train, for they're able to do that. In that school, they provide a lot of them kind of services, and we need for support them. We need for ensure that as then they graduate, then they within the regulatory framework. And one and really, at times they're right in the middle. And they're not to doctor, they're not to community care worker, and then this
And then right, the middle and provide support.
Yeah. So the allied health people then supposed to cover them, but at times the medical people then need for cover them. Again, you get some tension then between the surgeon them, real surgeon, and the CHO surgery them, you know. So now delicate that balance what they try for work with, but now important component of the workforce where we need. Again, we encourage the student enough for it, carry on the good work, role day for you now the healthcare system. And get the maintenance culture issue. We don't see this. You know, you work on some hospital there, if you have equipment graveyard, then just pack them no more. The reason for all of that now, because we know they're in charge. Somebody they come out China and say, oh, you know, this you want, a brand can't for it. Some people then go pass around and say, hey, you know, I see BP machine, let's say I go salon. So again, then they bring all the tears without rhyme or reason. What you don't try for do now forget a technical workforce. We don't create a new cadre in the ministry of biomedical technicians. Where they look for able for help you for know the kind of equipment where they order, for ensure say where the equipment can get the kind of service component proactively. And then get a cadre of junior technicians and senior technicians, even degree component up to PhD level, where they oversee the whole process. Again, this you will see them at times they wear really nice uniform there. Even we'll go Kono, you see them there in the background because they role now for support the nurses there and the doctor, then train them, and then in the background for able for solve the technical problem there. Will they bring new equipment and we'll bring much more advanced equipment in. For example, with the CT scan, we get a contract with Columbia University. We help we for identify the equipment them. They help we for procure the equipment them. Then they help we for install the equipment them. And then they help we with the training associated with them, and ensure say we able to do concordance between the early readings in Colombia, because now digital thing now, so you don't done it in, you can text them or you can send them electronically with to a radiographer in New York, where they work with a counterpart now, combining training with support services. Again, the equipment, they all get long-term warranty. We don't buy much more higher echocardiogram machine than we go buy high-end ultrasound machine, about 10 of them, where they put all side, but they all come with warranty, they all come with the requisite training with the again, I'm not seeing get a culture of maintenance with all man they complain about. We use them as a learning opportunity for ensure say what may not happen before, it not happen again. Because we actively involve in reprocurement, in retraining, in we support services. And the most important thing about that, not to the equipment, not the service. And for ensure say the service get delivered, and whatever it takes to ensure that the service is consistently delivered is what we're working on. So I let them doubt where people then get, because then doubt they inspire we. Because again, I will say, if you go and get radiology unit now, cannot, then get an old machine with it. In fact, it's nearly impossible for move them now. we get a radioisotope inside it they decay slowly. Yeah? The lifespan of about 10 years. But even when the lifespan undone for dispose of the remaining radioisotope, it's extremely difficult. So you get carcass then they. We know how to make that same mistake. So they make sure say what you want and what you need. The linear accelerator with a high-end equipment, now when they bring camp. Even the Cobalt 16 I just back up. Yeah. So I'm glad the way people in the show concerned, we're not to mirror to ourselves. We're not to see ourselves. And we're not to work for ourselves. We work for the public. So the public get concerned, we roll now for listen and for act on that. And again, I just want to assure people that let them see what they go on. This is not them what they work for, not the end users of the product. Let them tell we what they happen. Let them not rely on a historical experience.
Yeah.
Let them go there now and see what they happen. And again, I know I'm vouch for all man, but you get a new kind of approach now the healthcare delivery with the correct research. With the see what they go on. The other day, some student and come up, I think I put on and come out and come. Oh, they don't hear this. They don't pull you on the payroll. They don't pull you on the payroll. Yeah, what you do? Oh, we go study leave without permission. You go study leave without permission. Then you want for day on the payroll. How ignorant or how. Anyway, I don't want to use a public forum this, But again, now that kind of thing, one remove that impunity.
Yeah.
Wait, the person they do something wrong, even no stuff that wrong they do, Now that now one remove completely, you get an accountability contract. Where if I go in a hospital and see now 10 people in for day on night shift, you know what they go for? Not to then 10 people that will not show up for work, not to then 9 people that will not show up for work, and the mates were they in charge. Because you need for no say 10 people and you know what they deal with, not to assembly line, not to factory, not to carry the fix, not to tie the fix. Now people in life.
Yeah, you
Yeah?
might.
If the government don't pay for 10 nurse them for do night duty, 3 of them not show up, they put everybody in our day in life at risk. And it's completely unacceptable. So like the kind of thing that we like is, they non-thief something. The other day, then get a situation around the hospital. We then supply oxytocin, one of the important things that we Bella woman them for use, they allow compression for let the baby then born. Then send about 200 doses of the oxytocin now on facility. Then go there 2 weeks later, 2 women then go born, the oxytocin is not there. Well, you go say, oh no, then thief did. No, that's not thief. A murder. They don't kill 2 people then. So now for begin calling here as it is, so that people then will understand the seriousness of it. See now people in life then they play with. So all the one that they really do perform fantastic job, we they applaud them, we they congratulate them. But anybody, if you say, like for example, 2 years ago, then catch somebody at the border with the smuggle about 50,000 HIV test kits. It's not a theft. What it mean? You get 50,000 people then we for know their HIV status, we go prevent them from transmitting, we go save their own life. You don't prevent them from that.
Yeah.
So not a simple theft.
Yeah, it's us also. Somebody they ask about the healthcare workers.
Yes, they own side of them. Yeah?
Yes, how waiting at the condition, waiting at the benefit.
The waiting happen, healthcare work, like the kind of what they do so, you need for be able to compensate people adequately for what they do. Yeah? But healthcare work, not to commercial work, not to money they bring you come at the space. Not caring about people, now they bring you come at the space. So they make sure say anybody will get pin, everybody will get the team of the government do extremely well. Anybody will get PIN code, they get paid. No matter what it is, they get paid. In special circumstances during emergencies, they can get additional allowances that will go for them. Yeah. But what's going to happen? People that will not get PIN code, now that's not the problem. So you say let them volunteer. How you go volunteer for 1 month, for 2 months, for 3 months, for 1 year, for 2 years, where you get family in hours for feed. So the whole notion of volunteering, I think now false premise. I really want for completely get rid of them. Not able for make sure say people that will work in the hospital, now paid people them, will they do a service, we accountable. You know, we they run this problem now because IMF and World Bank get wage ceiling them. So right now, as a good example, all of the government investment in the healthcare, for the service provision of healthcare, 75% they go into salaries and wages. 75%. So now only 25% they left now for do all the other services. Now when would they go out, they go big. Now when would they go out for create partnerships around them. You know? So what's happening now, if you want for increase the wage, you get challenges from the IMF and World Bank, say, well, what's happening? You don't increase the wage bill. But so they try to see how best to overcome that. We look for alternative ways of bringing people on board, alternative ways of compensating people. Now we can get them boku workshop that we I don't agree with at all. But they get DSC associated with. Do not count against them wages. In fact, one of the things that what they do now, I think it will be really nice. We see them, we not sending the Fodonpa, Okada every now and again.
Yeah.
We try for firm boss for them. You know, bosses that we're able to move them around so they're not able to compete with everybody else and they maintain their dignity and respect as they go
Quickly, few questions there we are one leaving on with. This one they say, Doctor, what are you doing with children born with club foot? Do you have any projects running to support these children? Another one say, Lamana, please ask Doctor what the way forward with the 100-bed hospital in Port Loco. Somebody they ask about Macaulay Street Hospital, say na 2 room, they use 2 room and parlor no more for check people them.
Macaulay Street, now 100 bed. Macaulay Street now the same kind. Now the 3 hospitals that I tell you about.
Yeah, we talk
Macaulay
about.
Street, Waterloo, and Lumley. But I go for them. I find somebody food. You know, again we don't get money in our ministry. We get for go big finance for see how to for best manage it. We're not able to deal with Kuwaiti bank directly. We get for work with Minister of Finance. But again, that's something we're not thorn now with flesh. We really want to correct that, and we'll do everything we can for able for support. Then 3 hospitals there. So the Port Loco Hospital, now other one down there. We really, oh man, the Port Loco Hospital now gift from UAE, but not tent. Not tent, in a 100-bed tent field hospital during COVID, then give it down there. So give it down there, the tent, then give 5 country them. So unfortunately in Salonia, the kind of rainfall what they get, that tent, it not gonna last 1 or 2 rainy season. The mildew where they grow up on them, it's just huge. So what you would decide for do, that for build a whole accessory around them. We build a canopy where they catch all of the rainwater and redirect the rainwater. We don't build, not complete yet, but 17 quarters for healthcare staff. The wall don't go up now, we need for roofer and finish them. Then get about 49 duplexes for staff. Then get a canteen. Then get an administrative building. Then get a warehouse, all of the process. All that even happen, where will they raise that $50 the airport for COVID tax. But that money they don't dry now we had. The work not done. Waiting happen back again. Then give you the incentive, then give you 2 mega generator for run. 2 big generators, I think about 1 megawatt or something generator for run the tent. Because the tent inside hot. If you don't get this air conditioner, it not go work. Nobody not go say. But the design is really nice. You get 10 different cubicle and 10 bed each. All of the equipment and supply there. But what's happening now for able for connect the power. So they pan this Port Loco then can lend one the generator. So that generator now they supply power to the whole of Port Loco and during dry season. When they now they use the Bankosonka dam. So now with this talk with EDSA, they generate all this revenue. All what they ask for, though we get connection, between we own generator una don't lend for you, una they use make money pan, link them back to the hospital so we will for open this place. That all we there. That normally the only the staff ready we don't
So now
accept
power
it.
make the place not operational.
Well, now power make the place not operational. Again, not too small. We'll try to see if we can get solar solution in short term. But then the generator big pass is us.
Yeah.
Yeah. If you watch the power,
But maybe
the
then
fuel,
somebody can pay for it, so like you said, and they make money. Then this
It's
generator,
make money
they can take
in
it.
our
and they
just
pay.
extension, about maybe a kilometer or so, or half a kilometer, a cord for just can't supply the hospital. We they left the generator, give them to them. In fact, if we the one said we can give them the second generator, if then they run out as long as the hospital get power. And then again, not to something we say, okay, Lord, bring one small 10 kVA, because not tents.
Yeah, and this generator now for the hospital.
Not for the hospital. So
How you coordinate with your colleagues them in addressing this? Because a lot of people were so excited that
they are so excited. Again, this is now modern facility. Again, if we able for Donham, if we able for Donham, again, say Ministry of Health not get money. We get for go big for him. So he had to go talk to the UAE people there, because then they say, well, you are working on not done it. Yeah? Waiting while we forgive on more money. But we have been very ambitious. Yeah. We've been very ambitious because of the cash flow we needed. Imagine if you get 47 duplexes for the nurse system, if you get 17 cottages for the doctor and senior staff, you get 100-bed hospital. You get administrative building, we get nearly 30 offices. You get a conference venue, we can sit 300 people. You get a warehouse. You get all of the ingredients for make a super duper hospital. So now down the line, they work on now for raise the revenue. Again, we'll work with Ministry of Finance for see how for raise that additional revenue there, because it's nearly there.
Don't forget Ministry of the Electricity, Ministry of Energy.
Ministry of Energy, because Ministry of Energy,
then
we don't
get
talk to them. Then get with generator. Again, in the last year, we say if you know what go bring with generator come back. But you go try for pull that generator, come up with lock and see what you got happen. But I think say you don't and we decide to maybe we'll get two nice buses that will go ferry staff from Port Local town to this new facility, because the place there, it really even with this MPOX, we want to see if we can use the MPOX as a good excuse for activator. Yeah. But the way the MPOX situation on Canada don't nearly stabilize, before.
Yeah, Saudi governments have been promissory hospital, right?
Yeah, now they talk now Kerry Town.
Kerry Town, okay.
So again, now soft loan of $50 million. The loan don't complete. We don't begin work on the designs of them. Again, come New Year, I did it. I did it. In fact, one of the biggest things the challenge that we'll get with Kerry Town, that prime location. As you blink, so people don't begin coach. As you so that constant battle, so one invest in building a perimeter fence. A complete perimeter fence will give you ownership of the property. So if you get this perimeter fence now, you get the hospital project they go on. You get the warehouse project they go on. You get the cancer treatment center they go on. We get an oxygen plant we did it now. We can support the whole of the western rural and beyond. It did it available for low complete that. Again, man, I tell you, it changed the landscape just on the oxygen side. 4 or 5 years ago, oxygen not in this country. Before them get slough, Sierra Leone oxygen factory, but that all been undone. Yeah, oxygen not been there. Take where COVID come, the only real treatment for COVID are oxygen. Yeah, so we're able to get some resources for that. So what you don't know now, we use them for buy oxygen plants them in situated in a key place them. Now, if you go Connaught, then get oxygen plant, they will go able for support the whole of the western area. Yeah, you go Port Local, you go McKinney, you go Kenema. We don't establish the units and they now. In fact, what you want to do now. Not to for only use oxygen at the big hospital them, but for able for supply oxygen even at the PHU them, because they get them canister, the cylinder them. it not depend on electricity. That pressurized air. Yeah. So if you get down there with the regulator, even if in a village you there, you be able to provide oxygen till the ambulance can take the
You
bus.
think say quickly, you think say addressing primary health care services could help we for address, a lot of we health issues there?
Or everything. Everything. Primary health care are the backbone of all healthcare delivery. Because what you do, you take healthcare as close to the people as possible, and you focus on prevention. You know, so let's just tell you some good example. Then Buster will be get the hospital on wheels, not what we been get. The Buster will get. They're not gonna every district in this country. You know the cool thing about the bus them, we then go on site, man them, not like for go hospital. Yeah, then they only go hospital as a result of trauma. They fall down on bike, they fed somebody, shook themselves, they get injury, then they go hospital. But the woman them regularly they go hospital for their own health and the baby in health. Yeah, any side where the boss go, all man they rush there. The man in the rush there in particular. You know what's happening in Lamana? With the boss go, they able to provide services to everybody where they there. But they also tell me what's they go on at the community where people are not can hospital yet for. Like some side and they go, the amount of high blood pressure where they did. Nearly 20% of the people then get high blood pressure where they can at the bus. And the implications for high blood pressure now, if you wait, say you see her in a hospital, it can have stroke, it can have kidney damage, it can have retinal problem. But if you see them in the community, you go able to intervene by diet, by exercise, by reducing your salt intake, by just modest movement. With the see the diabetes rate, the sugar rate is extremely high. In some cases, we see the STD rates, the sexually transmitted disease rate is extremely high. The HIV rates is extremely high. But they know they show up in the hospital. Now, with the boss they come, then all man they begin to see what's in the go inside the community. So it help we now for take full advantage of that, how you get primary healthcare intervention. For go inside the community now, you able for identify and address her before he land in the hospital.
Somebody na Kamakwe say, please, say Leone not forget them. You say Kamakwe, Karine.
Karine, will they build brand new hospital there? Brand new 100-bed hospital. In fact, in the next few weeks at the good itself, will they get brand new hospital? So Kamakwe then get hospital, but I think they will get Batkanu and they will build the hospital. I think if I don't go about 3/4 of the way for that building there, I go for go when I sit down at your building, you can't they see me again. Because when they go out now in the field for see what's in they go on, I mean like what you see na Kono with the accelerator on all sides. Okay. So Moyamba, Pujong, Karine, then they're on the block. Right now they raise some money for 3 other major hospitals in the country and now they're in the works.
Finally, what's in now you hope, what's you want to see the country health sector, as we Minister of Health?
So, well, body business, again, I did real joy this but salon, where I don't know, people are not seem for, they understand. The president, a smart guy. The president knows say, look, for let any country develop, you get for invest in the person, in the people them. So again, when you say that in a generic statement, which I mean, so you don't reduce them for we say, which I mean by that, let we focus on education, let we focus on health, let we focus on agriculture, let we focus on infrastructure. Yeah. So for me, would they see health not as an end in itself, but health not the platform for development. You know what will be a good teacher if you know well. You know what will be a good lawyer if you know well. You know what will be a good farmer if you know well. So the well-body business now an important ingredient for the country in development. And the other way we want to see now, not to events. Healthcare not to one thing, What you want to do, we want to make sure, say, we need to look this country healthcare. You start with the belly woman. Go make sure, say, the belly woman, you okay, it deliver fine. Where the baby deliver, with the BNM. That baby there, it get for thrive, not to just survive now no more. The baby get for thrive. Where the baby thrive, it ready for school. We make sure, say, in our school, it able to learn where you take care of your health. We don't turn young adults that you don't get all the advantage here. For we born without problem. For we you don't get all the immaculates that we young. For we you don't avoid stunting. You get the nutritional thing. You don't get vitamin A and everything. You ready for go school. We don't go school. You don't study hard. You don't turn young adults. You don't turn adult and senior citizen. Now baton race. If you do well from the pregnancy, you dey see am pan the baby. If you do well pan the baby, you dey see am pan the toddler. If you do well pan the toddler, you dey see am pan the adolescent. If you do well pan the adolescent, you see am pan the adult and pan the senior citizen. So we dey do all anything and they together. But it's overwhelming. For you best monitor them, we get small window them. Who they say, okay, I'll take the pregnant woman then. So they can't resolve the whole they see so. That way you focus on pregnant woman and what you need for do for them. With the focus on picking them. Which you do for the picking them. Again, if you don't get this picking so in brain don't develop well, you not shorten, you not malnourished, you not get malaria at the very critical stage in life, you not get TB, you not get HIV, yeah? You don't ready for school. You know, with this school, for like begin learn, I swear to God, you know, you get sense you not go able for learn if you know the see fine. If you hear it not correct. You don't go do well if you get diarrhea, if you get upper respiratory tract infection. So one focus that within this school as they learn, we ensure see their health they in place. So throughout, now baton, as you do earlier, now you see on the other side, as you do earlier.
Where
so
will
now
the big one then now?
The big one them. So the big one them, now I make at you see, Lamrana, not so, you know, they focus by one, you focus by all.
Okay.
Yeah, you focus by all at the same time. But for you get they able for manage them now for say somebody they way they take care of Lamrana and age. I mean, want to say something this year, I hard for understand, yeah? But the last time I go, I hear a president they talk. It looked like the president instead said don't get him. You know, because they say, look, at this stage in my life, which are the worry about, I mean blood pressure, and then she say I take care of me prostate, it makes sure say I get me eye. You know, then in your own stage in life, now you get for take care of. You know, so one let all the one a day and let people themselves contribute to their own healthcare. Healthcare not to hospital. Hospital na last resort. Yeah? If you they say anytime we go cabinet they say Mr. Maggie, you know, if you dey eat boku Maggie, you dey eat boku salt, you go check your blood pressure and see what's happen. Yeah? Your blood pressure they go up. And if the blood pressure go up, this heart will get. Imagine something they walk boom, 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 boom. 10 years, bring salt to the meal. So I want a situation where we view health as we pathway for national development. I swear to my man God, you know, if me don't invest in your health, now my village, for the picking them, till and turn adults, I don't need for begin worry about them. They're all strong for fend for themselves. They all go able for innovate. They all go able for create. So if we look for national development, we say, let us focus on education. Education, not to book learning and pass exam no more. The education, as the president said now, for understand you in your environment. Yeah? Not to for just begin say, they use the phone and they call it. You want to know what's in the inside the phone. What's in there at the back end for understanding. Now the innovation they come. Now the creativity they come.
Yeah.
And if you get that with well body now, and you know say you bell full, but this country we not get limits.
Yeah,
now,
go
now
before.
8.5 million people. Round country, north to south, east to west now, 6-7 hours. You get 16 cool district them. Where you no need for just work on national, they begin get local competition district by district. The reason we make for this tiers or not bill and Africa that corner, we can't go corner. a proof of concept. So you can do this na Karina. You can do am na Koinadugu. You can do am na Kenema. You can do am na Bonth. You can do am na Pujang. So now that we don't show proof of concept, watch this space. Over the next 18 months or so, we did change all things, you know? And like I say, when we party there, and they say, we ready for help you and your president because we believe which you they try for do the health sector. And funding, not a problem. Funding a problem in terms of who say it come out now. But if you should say, if you give me penny, you go see the impact of that penny there. There's some real thought don't go inside. You just see the return on investment for that penny there. People then they can't we.
Yeah,
it's can't we. Yeah. Right now, as you know, I'm at the chair for the Global Financial Facility. I go Dakar in the next week or so for call me by the Minister of Health for see how best we go for deal with the situation. Because now one me other party don't call we say, look, we're gonna build a digital health platform for the whole continent. You know, we they use Sierra Leone, Nigeria, Rwanda, and Ethiopia as models. You know, now that kind of thing they do, and you know, like in a senior citizen now,
yeah,
they're ready for exit.
And the ordinary Sierra Leonean really go once ladies, all language here we don't talk about reflects on their life.
Yes.
How do they go to the hospital and feel it and see it?
Yes.
And hope, believe, say, if I sick, I go to the clinic around me, the hospital around, and get the service.
Yeah. So that's the ultimate test. All what you they do so now processes and equipment, which in enemy, you know what I mean? Nothing. If the person not feel them.
Yeah.
Yeah. So what you they try for do this now service ministry, we want to make sure say what you they do. The people that feel like, hey, right now, you understand, the people are impatient, small bit. They say, waiting, all this talk, this. Again, that process. They tell people and say, this is not like urban development. They say, can't fix Freetown. Freetown, you get cathedral, Ostimapia, you go broke them, yeah? You get law courts here, you get state, you know they broke them, yeah? You go build around them, you go adjust. So now that's what they do on a national scale. So we not reach the 8. But we're in the process. So what you want let all man do now for suicide this they go and contribute to them and join me. The Connaught people that were so glad about them. Again, this now nothing for do with government or nothing for do with PIH and now the Connaught people them then collaboration and then cooperation for get this kind of health output.
Okay.
Now they look for. So this now for Salone. You know, the question is say, not so for me. In time they done in a few years. But it want for leave a strong legacy where no matter what happens, we all go proud, seeing how this what they do.
Okay.
Yeah.
Well, Doc, finally, there is this argument about Ura for pick body na ticket.
Yes.
The ministry gets any role for play in that?
Yes.
Especially in Africa?
The ministry get role for play. The ministry main responsibility now, if somebody die in a hospital, now we role and responsibility for manage and for bury them with dignity and respect. For the destitute people, you know, we get a meeting at Parliament a few years ago, maybe a year ago. So how for best get an SOP on how for do this? You know, the city get responsibility for pick up destitute and the dead. Connaught Hospital, what you mean? One guy in this Sine. I don't know if you know Sine.
Yeah, Sine. Yeah?
Sine are one of the most dedicated people that we see where they work now mortuary space. Sine being decided say, we not wait for nobody, not wait for no law. Anybody will die within our street, we they go collect them. We they go collect the body them and we bring kind of Connaught. And the refrigeration may they go on and off. But this not destitute body them, but we can keep on there for a while. But it begins smelling, it upset the neighborhood. So by 30 days, they get out all of the one that way nobody can claim and go bury them, you know. They do that on a regular basis. Sometimes they lend money people and they big, then they contribute. They do this while seamlessly. You know, the social media business, people like say, Sine they go sell body parts. Yeah? Then go bury some the body them one penny body in and stick up so. But now rigor mortis, rigor mortis, if you die, you and this na so you dey. Yeah? So then bury the hand and say, oh no, the people are not die safe. Then they go bury them alive. So then put warrant of arrest for Sine. Not to come on hide Sine, they hide, they run away from this.
Parliament invite them all.
Parliament invite them all, them one for go arrest and they what? No, this is man saying help at the help. So after all that, they say, okay, well, me I not did it again. Because the big problem with before they now, Ministry of Health not they touch anybody or anything, if not to hospital then die. Because what happens, sometimes in criminal, sometimes in police business. So the coroner's office get for can look, see, say this now cause of death because of this one, hospital now can take it now. So now something where the city council, the IG's office, the Ministry of Health, we all need for sit on one side. They don't get SOPs, standard operating procedures, we then put out on how to carry this out. There is no value in finger pointing. There's no value in pointing at anybody. Lord, look for solutions. Again, this is a sad situation in the country. And I think we can find a solution where everybody they do their part for ensure, say, first, this not happen. But if it happen, it will be for management with dignity and respect.
Finally, while we wait for the president for a message, as you say, hopefully, but waiting are your message to Sierra Leoneans, with this situation we'll get presently with the drugs and all of it. What do you want to tell Sierra Leoneans already watch and listen to it this morning?
My message now as a Sierra Leonean, this now something where is not acceptable. We youth, then they die of this unnecessarily, but now deep-seated problem will require the society, everybody, for participate in the solution. Anybody will sit down where they say, now you fault, now you wouldn't call, now you finger pointing, they help the situation. I think we all get for do a national effort, we all get for do a district level effort, we all get for do a chieftain level effort, we all get for do a neighborhood effort, we all get for do a household effort. Everybody. All them people where they get them drug, so they get mommy and daddy. Yeah? Mommy and daddy themselves get rolled, they get uncle them, they get cousin them. Yeah? Me waiting me no want letting people that say, oh no, una build more hospital, una build more clinic for them. Because that's not the answer. If we not deal with this thing holistically, it will really impact on all of the gains we have. But I know say Salone are a resilient people. No problem not there. If we come together, we know the solver. Now wasted energy, wasted time, wasted effort for begin blame Uda and Uda and Uda. If everybody you focus on, what's in me go do on my own part for contribute for arrest this year, and say we get 8.5 million people here. If 6 million people, 6.5 million people, they all say me, I not say we lie now about me. Now this now they do. In the shortest while we can able for counter this. Okay. And the folks then with the as well now for Lord keep the faith and fight this battle. Again, for the diaspora and them. For the diaspora and them. Again, this now we country. This now we home. Then we do all we can for protect this home. Who that else go protect them for we? Yeah. But if the diaspora sit on the then they import the product, then get counterparts and they do all kinds of things. And then someone they complain about waiting to happen, waiting not happen. I think say we're not going to win this battle. But again, that's not so we. We will always win.
Thank you so much.
Win, yeah?
Now that hope they keep we alive. Now they make we do it with it. But thank you so much, Dr. Austin Demby, the Minister of Health, for talking to us this morning. And hopefully we'll ever get you some other time. We don't get the commitment then this morning. We have go the monitor and see what's in the happen. And hopefully we'll get another conversation. Thanks for joining us.
Well, I just want to personally thank you for your professionalism. I know you done the in this trade for a while, but forget your own space and bring your own style and you bring your own honesty and truth to power. It'll give you grace. it give you hope for this country. And everything you do, like I say, we not to mirror to ourselves. Now other person they see, and just be fair, be even, be balanced, be professional, and we all pray for you.
Thank you so much.
Thank you very
The only thing I go ask you for now for ring this.
Well, but you not give me credit, say you say wear me same African with you.
You know what you want? Yeah. That's the Minister of Health, they ring the bell for you. You know what you want to say about the Afrikaner? Now that the president they lead by example.
Yes.
I see a lot of ministers and other officials them. They get into the Afrikaner, thing.
For me, at the federal now the Colipa and small bit, I just I get for advanced to that level now.
Hopefully. Well, thank you so much. It's been a very, educative the conversation, and people and all learn a lot. Now that's what they try for Dunaya. They'll get the people in authority. And they always say, if you not come and tell people what they do, accept the challenges and see how we all go collectively address them. Because like what the minister said, how they go to the hospital more. But I think, Mr. Minister, what we also need now maybe a toll line. Outside people could call and complain.
Yeah.
If they go to any public hospital and see problem, they able to call and give complaint. I think that's very important.
I think that's very important. And also what should they do now? Forget a public charter. A public charter we published. We associate this on side and this on side, but if they go to the hospital, they see all what they do now, from hernia operation to diagnostics to human, all in a big billboard. So you know they go now with and say, this hernia operation at 10 Leone, then somebody will say, give me 500 Leone or whatever. It's unacceptable, but the charter point onto the charter. So again, we can forget our public charter there, and we'll create also a very active website. We will get the toll-free number as well, and ensure, this country, you and me and everybody, we go fix it. We
should definitely. But thank you so much. We'll take a quick break. The minister, the left we will come and can close, continue for stay with we.
Yeah.